Good morning, sir. Here is a 6-year-old child, Master Girish, who is admitted with dysentery. But I am a bit concerned about his CBC report. His WBC count is 62,000 with predominant neutrophilia. Otherwise, he is mild anemia and his platelet count within normal range. I think we should rule out leukemia in this child.
Okay. Dr. Rakshita, can you please tell what this condition could be?
Sir, I think the elevated WBC count more likely a leukemia reaction rather than leukemia.
Okay. Can you explain us what is leukemia reaction?
Yes, sir. Leukemia reaction is a condition wherein there is non-malignant elevation of WBC count of more than 50,000 per microliter and is characterized by the presence of immature WBCs in the peripheral blood. The excessive leukocytosis and the presence of immature WBCs on peripheral smear makes it resemble like leukemia. Hence, it is called leukemia reaction. Most of the times, the leukocytosis is due to elevation of neutrophil component.
Good. Can you tell the conditions where leukemia reaction can be seen?
Sir, leukemia reaction can be seen in children with severe bacterial infection due to Shigella, Salmonellosis, Meningococcemia, pneumococcal pneumonia, and miliary tuberculosis. It is also seen in overt inflammatory states like pancreatitis. It is noted even a case of physiological stress, ingestion of certain drugs, and also rarely in infants with Down syndrome, that is transient neonatal leukemia reaction.
Dr. Rakshita, do you know what is left shift with respect to the WBC count?
Sir, left shift is defined as the presence of more than 5% immature neutrophils in peripheral blood, which can be seen in children with serious bacterial infections, trauma, burns, post-surgery, acute hemolysis, and hemorrhage.
Good. Now, how will you further evaluate this child and how do you differentiate leukemia reaction from leukemia?
Sir, the most important thing is to know the clinical presentation and patient scenario, which will give us important clues towards underlying cause. The next important thing is to do a peripheral smear. By carefully analyzing the CBC and peripheral smear, we can distinguish between leukemia reaction and leukemia.
So, how will you differentiate?
Sir, in a case of leukemia reaction, though there is excessive leukocytosis of more than 50,000, rarely will it exceed 1 lakh, whereas in case of leukemia, the total leukocyte counts can exceed 1 lakh. Also on peripheral smear, the portion of immature cells is usually small or moderate in case of leukemia reaction with myelocytes that seldom exceed 5 to 15% and blast cells usually don't exceed beyond 5%. Whereas in case of leukemia, the blasts in the peripheral smear are more than 5%. In case of leukemia reaction, WBC population is composed of largely mature neutrophils and there is predominance of late series of neutrophils lineage, that is band forms and metamyelocytes with early cell lines, that is promyelocytes, myelocytes and blast cells being progressively rare. In case of leukemia, the early cells, that is myeloblasts, promyelocytes and myelocytes are predominant. Meanwhile, we can also look for toxic changes in the neutrophils on peripheral smear like toxic granulations if the leukemia reaction is due to infective etiology, whereas in a case of leukemia, we see more of atypical cells. When still in doubt, we can do bone marrow examination where we can see increased granulopoiesis with normal maturation and morphology of marrow cells. Where in case of leukemia, we can see malignant cells and excess blasts. Also, the marrow cells will have normal cytogenic profile, whereas in case of leukemia, it will be abnormal.
Good. My last question is, what do you mean by leukoerythroblastic reaction?
Sir, leukoerythroblastic reaction is characterized by the presence of erythroblasts and granulocyte precursors in the blood. It can be seen in patients with severe megaloblastic anemia, severe hemolysis, miliary tuberculosis, and primary myelofibrosis.
Very good, Dr. Akshita. We shall do a peripheral smear for the child and look for features that help us to differentiate it from leukemia. We'll treat the child with appropriate antibiotics and monitor the child. Thank you.